supporting communities around, away from Entebbe Regional Referral Hospital, which is of course a collection center of about 5 districts, but this is a lower health center that of course supports the community around. And we know very well that of course Rotary, whose theme is built on supporting communities, many of them have chosen to take different directions of how they can support communities. We've seen some of them being involved into building schools, others are trying to renovate health centers, among other things that you know that communities may need. But of course, here at Kajansi Health Facility, the Rotary Club of Entebbe has picked interest in supporting it in various areas. We know government does its part, but of course there are those people who have good hearts that also keep buying interest into supporting them. But this time I want to just speak to the president of the Rotary Club of Entebbe to just paint for us a picture of why they picked interest in, among all other health centers, choosing Kajansi Health Center to be the project, to be the ideal health center that they wanted to support. And this is Rotarian George Bush Ocheng. Thank you very much for joining me on NTV.
Thank you, Ivan. Good morning.
Yes. Now, we want you to tell us, why did you choose among all other health centers, Kajansi Health Center that you want to support?
Ivan, every day 16 mothers die when they are producing children. Wakiso in Uganda has the largest number of mothers dying when they are producing children. Kajansi falls in Wakiso. We, coming from the Rotary Club of Entebbe, we would have helped the Entebbe Referral Hospital. But Entebbe Referral Hospital is better equipped on facilities that help mothers when they are going to produce children. Kajansi Health Center 4 had just been upgraded to this level and lacks many of these equipment. We did a needs assessment.
When you're talking about supporting it, which areas are you looking at? You've talked about maternal health, but which is a broad concept. What exactly are you talking about when you say this?
When we did a research, we discovered that 3 things lead to mothers to die. Number 1, poor transportation from where they are in their homes to the health centers. When they reach health centers, the numbers of deaths to drop. So there's lack of transport for mothers who want to produce children. The commonest transport in this country is a boda boda. Boda bodas can't carry a mother who wants to produce a child. So designing a village tricycle ambulance, what we call TVA, is one of the best solutions we have thought for this one. And this health center will be getting this soon. Another thing we thought about is mothers die when they do not have oxygen for themselves and oxygen for the children. So bringing an oxygen concentrator to Kajansi Health Center is in a way solving that predictor of death of mothers and children. The third one is the baby warmer or baby incubator. Absence of this, yet a child has come from a warm womb but reaches the outside world and they can't warm themselves, they are unable to warm themselves. This small but cheap equipment relatively is a magic sender that children will survive if you just plug it into power and keep a child for 1 or 2 hours or 3 hours. They were lacking these, and that's what we brought today.
I understand that you are also planning to rally the public. I don't know whether your efforts are worth, or you think also some other well-wishers can still join you in this cause, because perhaps it could be another person that's willing to join hands with you or also to come and support in this. Which other areas you think maybe needs to be supported?
First of all, we need people to support this very project, especially the community of this area. And that's why at handover, when we saw the community leaders like the mayor, the LC3 chairman, the LC2, the LC1 leaders, we are happy. They themselves should own this equipment. We are not going to come here and own this equipment. So the first thing is to own. The second thing is to ensure that simple sustainability costs are solved by them. To pick a mother from Nalugala and bring her to this hospital might require fuel of 5,000 shillings. Let the community look for this money. Repairing the tire of a motorcycle could be cheap, could cost another 5,000 shillings. These are the things we would like the communities to come and do. Finally, they could join us in Rotary. Members of this community should join Rotary clubs. Between Entebbe and Kampala, there are 15 Rotary clubs. If you join the Rotary club, you will be making a contribution. Part of the money we have used to buy these things is money from Rotary International. Rotary International only gets this money from Rotarians like us. So we appeal to the outside community, come, join any Rotary club that is near you, that you wish to associate with, and you'll be making a contribution. Sometimes the contribution is as small as 5,000 shillings. The mama kits we gave out cost 20,000 shillings, but yet it is a game changer for every mother going to produce a child. When she has a mama kit, she'll run away from a traditional birth attendant and come to a health center like this.
If someone is in Entebbe and wants perhaps to bring something to the Rotary Club of Entebbe to support this same community or the hospital, where do they find you in Entebbe?
In Entebbe, the Rotary Club of Entebbe meets at Admas Hotel. This is in the city center. It is the 5-star hotel in Entebbe. We meet there every Wednesday, 7 to 9 p.m. But you can always just ask them that I would like to meet any member from the Rotary Club, and we shall send you somebody to meet you. You could always call us. You Google us into the social media, into the internet, you'll get our contacts. Every year there's a president, and the president's numbers are public. You'll always get us, and your contribution will reach. Actually, in Rotary, each shilling you give us, we spend 1.5 shillings, because we as Rotarians, you are interested with your money, we add on our own money to do more. We haven't charged any of our members to come and do this. We spend our own monies.
Okay, for time reasons, we'll end it here, but Rotarian Ocheng, thank you very much for speaking to us.
Thank you, Ivan, and we wish mothers better mother safe food. Thank you very much.
Well, that is the president of the Rotary Club of Entebbe just speaking to us, of course, on humanitarian efforts, the efforts that they feel mothers should be supported more. And maternal health care is partly what they've picked as an interesting project to work on here at Kajansi Health Center for. But for time reasons, I want to get back to the studios. Very good morning to you and our audience.